this isn't a repeat for children, it's for people in care homes, but there are remarkable similarities of the most vulnerable. I think we now have a more cost-effective way for these people to get the care that they need. It's by empowering the rest of the dental team. So we know there are lots of deaths from aspirational pneumonias, so if we get people to show people how to clean their teeth and support the oral health ambassadors through our website, then we can do something. So this was published in The Economist earlier this year and explains the plight of people in care homes. To be frank, I've got very little experience of this, but I know someone who has, and so I've always sought their advice to make sure I'm basically on track. For years, Jane supported those oral health champions or oral health ambassadors through a series of free webinars, as well as some online courses. So please look at her website. Usually there may be some help from the government by empowering the nurses, as you can see here. So the ability to scan teeth, to actually take impressions and apply varnishes, as well as give instruction to the residents, but more importantly, the oral health champions, is a huge advance, as explained in the section on Tele-Dentistry and how we can reduce CO2 emissions, but also empower the nurses to earn money for themselves. And like all the dental team, they can be found on the new Dental Health Service website and app. The public can gain access to dental nurses, hygienists and dentists through the calendar with video explanations on how to do this. I made lots of animations in the past for my patients trying to explain about gum disease and how in care homes it leads to aspirational pneumonias, which is basically people don't clean their teeth adequately, and it's difficult for carers, but they can if they use this technique. Cleaning your own teeth with the other hand, or even clean someone else's teeth. It's not easy, but this brush and toothpaste really help. Details can be found on my Teeth for Life YouTube channel, which we will be rebranding as a dental health service. We're hoping to finance it through 3D printing. Our online portal will help the elderly who want to have new or replica dentures by using dental scanning and our 3D printers for a quicker and cheaper service, unlike the current historic method. So I made a separate video about the 3D printing and where I got my evidence from and how I did it myself. So hopefully you're looking on a laptop and can see these figures on the potential income as a nurse and as a business. Figures are loosely based around the NHS, but this is what private companies charge, and this is what the income would be for one visit. The spreadsheet also shows a fee for an asynchronous visit, because not only do you get a better visualization of the teeth, they often have a caries diagnostic tool, or to be legally correct, an assessment tool. We now have access to materials that have been used in the States and Canada for years, as well as Japan, that mean that we don't have to do difficult restorations. We can halt the decay process by simply applying a fluid. We also produce flexible trays with reservoirs to apply the fluid or gel in the appropriate spot, as advised by the dentist and applied by the oral health champion. It would require minimal training, as it would to take these photos. The cameras, pictures and videos are taken using these cameras that can be bought for about £50. Unfortunately, they're my teeth. And if you can't get to see a dentist, you can always do it yourself. This scanner costs £500, but it's very long-winded. And really, the object of this is just to try and persuade dentists to buy these scanners, as a lot of the time they sit idle in a practice when they could be put to good use in care homes and in schools, and helping to improve everyone's well-being.